Northern Hemisphere, we're moving into winter. Which is not that great because the virus doesn't survive under very hot conditions. We're now going into the opposite, which means that the virus will probably thrive. Would that be fair to say?
Well, I'm not sure if it's just the weather conditions, but it's also moving into what we call the flu season. So people are going to be impacted by the general influenza virus or the strain of the season in each cycle that you get every year. So you may have a circumstance in which people are now having their immune systems overburdened. Firstly, by the potential risk of exposure to the COVID-19 infection and the influenza virus at the same time. That doesn't change the dynamic in a South African context or other contexts in which patients may have underlying chronic illnesses and immune conditions, for example, HIV and AIDS, diabetes, pre-existing heart conditions, and other conditions that may be poorly controlled, advanced age, young age, which there's little data on at the moment. So there are many dynamics which put you at risk. Moving into the winter season or the colder seasons also promotes people staying indoors, which means you expose your family and friends and people in your closer circles because there's less time spent outside due to weather conditions and you want to stay indoors. It may be great for self-isolation, but if you are staying in closed environments that involve more people than your immediate family, you potentially could be spreading the risk and or exposing yourself to the infection and or reinfections. Because there is data now out of China, confirmed as of yesterday on the latest clinical studies, that patients who have been treated and cured effectively of symptoms have been reinfected with the coronavirus and are being treated yet again. So it's not a circumstance of you were treated, you're cured, you'll never get it again. You could be exposed multiple times.